Advanced Physical Therapy and Wellness, and we'll be going over the shotgun technique, aka the finishing technique. So they call it the shotgun technique essentially because if you don't have a good understanding of SI joint dysfunction, rotations of innominates or torsions of the sacrum, then essentially you can do this technique as a shotgun approach. Like, okay, let's just see if this helps. If they're presenting, they got pain in like this area or even just low back pain, and you find some stuff off, but you're like, I don't remember how to do the thing, the rotations, up slips, and the sacrum torsion. I mean, it is kind of complicated. So if you're like, well, I just want to help this patient and see if this helps, and if it relieves the pain, sweet. But essentially, the shotgun technique can have an effect on, the SI joint, but it's more so directed at the pubic symphysis than anything else. Because essentially, the reason why I use that as a finishing technique, I will correct the rotations of the innominate or the torsions of the sacrum, and then I'll do it as a finishing technique to make sure that the pubic symphysis is in line. Because if the pubic symphysis is still off, it's kind of like off like that. See how that's off, then that's probably going to make the other portion fall out of place a lot faster. So it's like I can correct that, but if I correct that and this is still off, then eventually it's going to slip back out. So in order to maximize my patient gains, I use it as a finishing technique. So if I correct sacral torsion or correct an innominate rotation or upslip or whatever, then I will do this last but not least. So essentially we did all the math and research when I was in PT school of all the hip adductors that all attach to parts of the pelvis right up and through here. So you got some that attach here, 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 all the way around. And every single force vector equaled out when you did a maximum adduction contraction moment, equaled out to 2 arrows that went straight head on right here, right at the pubic symphysis. So essentially, when you push out with the hip abductors, push out, push out, push out, push out, push out 3 times, or however many times you want to do it, and then do a forceful hip adduction, boom, then everything slides into place. So oftentimes that's where you hear the joint cavitation. You hear a little click, because it literally clicks into place. And oftentimes, I'd say 90% of the time, the patients feel a sharp pain for just 1 second. Like they're like, ah, and they go, okay, I'm fine now. Occasionally you run into an oddball that goes, that was not painful at all. I'm like, okay, cool, that's good. So normally when I do the finishing technique, or if anyone does a shotgun technique, I always warn the patient. I say, after doing the hip abduction, when I say right before I do the hip adduction, now you don't have to forcefully, violently open it. I've just found personally that that's how I've gotten the maximum correction there. But if someone like my wife, Jen, she doesn't like that. She won't let me do it on her. So you can just take 2 fists and put it in between the knees and just have them squeeze, or take a ball and put it between the knees and have them squeeze. But I, like I said, prefer to push it out. So I'll warn the patients first and say, hey, so before we do this, you're gonna push your knees inward. You're not gonna let me push them out. And then, but the caveat is you might feel a sharp pain for just 1 second and then hear a little click. That's perfectly normal because that force vector is very intense. And when they hear a joint cavitation, you don't want to think it's something broke. It's really something fixed. And so usually they feel a lot better knowing that beforehand.